Good afternoon, my name is Aspen Wooten, and my topic of research is the mental health of student athletes. A student athlete's mental health is influenced by a variety of factors. These factors include their academics, the media, their social life, their performance in sports, parents, and even their coaches. Although these elements are essential, they nevertheless have a detrimental effect on some athletes and may ultimately result in burnout and mental health concerns. This then leads to our question: how does school, the media, and other outside resources negatively affect high school and college athletes' mental states? To start, one of our major factors is school. Athletes train almost every day, and because of this rigorous training, they come home to piles of homework. Due to this, athletes may have trouble maintaining their academic performances. These practices can be in early mornings, late at night, or even after school. With the lack of sleep and rest the athlete may receive, a majority of athletes are mentally drained. This all adds on to the amount of pressure of athletes, and some athletes aren't able to manage it. This can lead their social, academics, and sport performances to deteriorate. In this graph by the NCAA, 74% of females felt overwhelmed by all they had to do, 52% for men. 68% of females felt mentally exhausted, and 49% felt mentally exhausted for males. And 33.2% had an occurrence of depressive issues. As you can see in this graph, it says that suicide is a leading cause of death among college students and athletes. Another major factor in the mental health of student athletes is the media and the press. The media and the press constantly put pressure on their athletes. Most college athletes have a high platform. This comes with fans and critics. With all the cameras and eyes on the young athlete, it's hard to keep things private. One little error or personal growth journey, and fans or the media are quick to judge. Psychology Today says that the toll of constant pressure is significant, while athletes struggle to manage the public's perceptions added to their personal lives. Using the College Board stimulus article, Simone Biles and the Most Human Meaning of Courage by Thompson, we can understand that Olympic gold medalist Simone Biles built up a lot of courage to pull out of the Olympics despite all the backlash she may have received to focus on her mental health. In the article, it says, Simone understood the truth would get her labeled as a quitter. Simone says, I was fighting all those demons, and no, the mental is not there. There, Simone spoke her truth to the world. Here's a clip of Simone Biles pulling out of the Olympics and telling her teammates.
Wow.
Very uncharacteristic vault for Simone, but it looked like she got almost lost in the air.
Now, the biggest factor in athletes' mental health are their parents and coaches. Parents and coaches are role models and important figures in the athlete's life. So it's essential for them to be all in and to support them positively. If these figures don't do that, then it can possibly lead their own athlete to burn out. Some ways that these figures negatively affect the athlete is through toxicity, comparing athletes, unrealistic expectations, lack of support, and overtraining. Toxicity is displayed through verbal abuse and public humiliation. Comparing athletes is when a parent or a coach compares their athlete to another athlete who could be better than them, and this can also lower a player's self-esteem and confidence. Lack of support. If a player doesn't receive recognition for their accomplishments, then it can lead to a loss of motivation and unrealistic expectations and overtraining. The NCAA says parents and coaches, often with good intentions, may push athletes towards specialization and intense training regimens, not realizing that this can contribute to a physical and mental exhaustion and ultimately burnout. Some solutions and limitations to helping better the programs for mental health for athletes is allow for more easy access to mental health programs. The media must recognize and support the help for mental health, and encouragement and trust from parents or coaches must become more relevant. And more programs to help athletes in school managing their time and their stress levels. With all of these solutions comes limitations. Number one, it's mainly cost prohibitive. And being able to help these athletes find these areas, we need to find more places to do that. Some parents and coaches may have to learn the skill of gaining their players' trust. And some people may still continue to deflect and hate, even though the media will start to positively discuss mental health. Here are my works cited pages, and thank you so much.
Sorry, no applause. I do have 2 questions for you though. So, was there evidence that you gathered that you didn't use, and then why wouldn't you use it, or why didn't you use it?
Yes. There was actually most of my evidence that I did gather were mainly I found they were all relevant. I did find some evidence on younger kids, but I didn't use it for elementary school kids coming out and starting training at a young age because it just wasn't relevant to my research question. It was more towards high school and college athletes, so I decided not to use it.
Okay, well, if you had more time, what additional research could you have done then?
I would have tuned in more with high school athletes, I feel like, because high school is more of a developmental stage, and when you're in college, it's more, you have less time. So you have more time in high school, and I feel like I should have got more information on them.